Thanks for joining us. My name is Daniel Daze. We begin on a sad note because the National Disaster Management Organization, NADMO, has confirmed that 5 bodies were found after the Sunday evening downpour. The 5 were discovered at different locations within Accra. Speaking on News Desk earlier, head of man-made disasters at NADMO, Alhaj Mohammed Abubakari, says they are continuing impact assessment of the floods to assist displaced persons.
Immediately after the rains, the impact is serious because so far, if I am right, we have so far picked about 5 dead bodies within the Accra metropolitan area. One dead body was picked around Awudome Cemetery area, and from our men and the police who were there, the person was struck by a thunder. And then another lady was also picked around Aveno, that is around the ECG offices behind the New Plant Station area. And then one from Dansuma area, and this morning too around Zongo Junction. So far, what we are doing is people who were trapped yesterday were rescued. Those who have been affected, the assessment is ongoing, and as the reports trickle in, we will submit it to the regional office and the headquarters, and then immediately action will be taken.
My colleague Maxwell Agbagba is with the NADMO team touring affected areas within Accra, and he joins us now. What has the team found so far, Maxwell?
Well, Daniel, so far we've been to Kumasi, we've also been to Adenta-Madina, where the NADMO coordinator, the Greater Caribbean NADMO coordinator, together with the team, have been touring these areas to ascertain exactly what happened yesterday. In one of the areas, we are told at Flamingo, a woman with her baby actually went missing right after the rain, and the husband of the deceased actually, the husband of the woman who went missing actually saw it play out right under his eyes when his wife actually tried to take refuge in a car that was parked in their compound. So the water actually entered their room. They came outside to take refuge in a pickup outside their home together with the baby. Then they went missing. But the husband, we are told, actually witnessed everything that went on. So as we speak right now, we have no glimmer of hope whatsoever that the two are still, alive. What is happening now is that there's a search underway for the 2 people. But as you've already heard, 3 other people have been confirmed dead, and that has been confirmed to us by NADMO coordinator. So we've been visiting the areas affected by the flood yesterday. One thing that we saw, the common denominator for all the areas that we visited, was that the flood was actually left with trails, broken trees and broken billboards, and then plastic fields drains. The NADMO coordinator is not happy about that. We want players in the plastic industry to do more to help in the disposal of our gases and also to help in keeping Ghana clean.
Thanks, Maxwell, for that update. Now, the Ghana Meteorological Agency is warning there will be more rains in the coming days. Head Central Analysis and Forecast for the agency, Michael Paddy, says the rains are just in time and people in low-lying areas should be on the alert.
In the morning at 6, then regularly also at 6 p.m. But in between, if we realize something quite unusual or something that will be a bit torrential, then we have to issue a weather warning or an update on weather warnings or the regular routine forecast that we've been issuing to the general public. We should expect at least 3 or more days in a week, rainy days. This will occur mostly mostly over the inland areas. That's Ashanti, the Volta region, especially areas around the Volta Lake where we have lots of moisture. Rain, the frequency will be quite high. Then the eastern region, Wahoo area, and Koko on the mountains. Those obstructions also have very high chance of producing clouds So those areas are areas whereby rainfall would be quite frequent. But along the coast, well, the East Coast, as you know, is not been getting rains regularly. So the East Coast will be quite free than the inland areas. As we move slightly inland, places like Dodowa, Ayukuma, those areas where we have the range of mountains, those areas will be quite frequent in terms of rain than very close to the coastline.
Away from flooding, and government will be setting a dangerous precedent if it goes ahead to pass a bill seeking to control the country's public universities. That's the warning by the University Teachers Association of Ghana, UTAG, which is kicking against the Public Universities Bill 2019. The bill, which is signed by Education Minister Dr. Matthew Opoku-Prempeh, seeks to regulate the activities of public universities under one law. Well, UTAG believes the bill, when passed, would give government extensive powers to control public universities in violation of academic freedom. Professor Kojo Appiaje-Itia speaks for University of Ghana Legon branch of UTAG.
The bill raises some interesting innovations, some of which are positive, some of which are negative. But I must say, in our opinion, the negatives outweigh the positive. One positive is that it is bringing one law which will regulate all public universities, which is a good thing. And then also another negative positive in the sense that it recognizes some level of autonomy for the university with respect to the individual teachers of the university. Apart from that, the provision as it stands will severely compromise academic freedom of the universities if it's enacted in the form it is now. When you talk about academic freedom, you are talking about the independence that the university itself, the teachers of the university, the students are supposed to enjoy on the campus. And this concept of academic freedom is to enable or facilitate research, dissemination of information, finding out new knowledge, which will then be used to promote teaching and promote the well-being of the society in general.
Now, still on this, minority spokesperson on education, Peter Nochu, is urging government to abandon its plans to introduce this fresh law to govern all public universities. He says the legislation is an attempt by government to control public universities, which will result in chaos. He says the minority will oppose the legislation when it's introduced in the House. And Mr. Nochu spoke to my colleague Joseph Opoku-Gakpo.
So, is it a good idea? Not at all, because it is not going to give any autonomy to the university authorities to govern the universities. We know for now the various laws that establish the universities allow government to appoint the chairman of the governing council of each public university and 2 or 3 other members, and that is enough. But the government still wants to have more than 50% of the members nominated. Why do you think government is doing this? Government is just trying to control the public universities, and that is not good. We should allow them to enjoy that autonomy. They should manage their own affairs so that they can deliver. We're talking about unnecessary government interference in the administration of universities. So what is going to happen is that even the appointment of the top management of our universities is going to be controlled by government. If you cast your mind back and you look at what happened at the University of Education, Winnipeg, which is also currently happening, and what was about to happen at Kwame Nkrumah University of Science and Technology, that is what is going to happen if we don't stop that bill from coming in. So chaos like that, disagreements like that, demonstrations like that, you envisage would see more of that if such a bill comes into effect? Exactly, because I don't think the universities or the authorities, lecturers and all those things would fold their arms and allow this bill to come to pass. No, what is also going to happen is that even admission to university is going to be controlled by governments. So they can decide, even if the child or the candidate did not get the cutoff point, you must admit the person. And those things will not augur well for good academic work at the universities.
So, as an MP, when such a legislation is eventually introduced in the form that is looking currently, how can we expect of you? Will you support it?
We will not support it because, number one, we want the universities to be autonomous. Two, each university is unique. So you don't put all of them in one basket and think that they should all operate within that basket. No, they should be allowed to work on their own. And when they do that, and they allow them to allow work on their own, then what is going to happen is that there will be more innovations. They will think outside the box and then progress. Let's give them that autonomy to continue to work with.
So your advice to governments would be that they do what exactly, even before they eventually introduce this into to Parliament? Would you rather want them to make changes to what exists currently?
Well, I have not seen it fully in the form that they want it to be. But with what I've heard so far, as I've said, they should change it or even abandon it altogether so that we allow the various universities to operate.
Still live on Joy News today. We stay with matters pertaining to Parliament because the minority of the House Monday morning continued their protest against Ayawaso West Wogon Member of Parliament Lady Aseiram Al-Hassan by refusing to comment on a statement she read on the floor. The MP delivered her maiden statement to the House calling for more health awareness as part of World Health Day celebration. But the minority stayed away from commenting on the statement in conformity with their decision not to recognize her as MP. Joseph Opohugakpo joins us live. Joe, what exactly happened?
So, Madam Sarah Hassan delivered a statement to mark World Health Day, which fell on the 7th of April, in which she made a point about how Ghana had made a lot of effort in ensuring universal health care for all, and all the investment that are being put into that currently, and the efforts at the level of the Health Ministry, the Ghana Health Service, and the NHIA to ensure situations where a lot more Ghanaians get access to quality, affordable health care. And then when she was done, the opportunity was given for members on both sides to contribute to the statement. There were contributions to that from the MP for Kede, Ahmed Tinyasi, as well as the board chairman of the Kolebu Teaching Hospital, an MP for Lejokuku, Dr. Okoboy. But when the speaker indicated that the opportunity should be given for the minority to contribute to the statement, its Chief Whip, Muntaka Mubarak, indicated that they would rather let it pass and that they weren't going to comment on the statement. The speaker, in fact, made a second attempt to give the minority the opportunity, particularly the leadership, to contribute to the statement. And again, Muntaka Mubarak indicated that they would rather let it pass. I've been engaging with some of the leadership at the level of the minority, and they indicate that they had made the point. Even you would recall the day she was sworn in when they marched all the way to the CID headquarters, that they wouldn't want to recognize her as an entity. And so even the statement that was delivered, well, they would rather not comment on that in order to give her any more legitimacy.
Thank you very much, Joseph Opoko-Gakpo, for that report. We move from Parliament and take you to Adenta-Madina because residents there are calling on the Ghana Highways Authority to ensure the April ending deadline for the completion of the footbridges there is met. The footbridges became subjects of concern after a persistent pedestrian knockdowns on the highway last year. Joy News' Kenneth Aochedako has been monitoring progress of the work and has come through with the following report.
Between January and 31st October 2018, the police MTTD recorded about 24 deaths and 164 injuries on the Adenta-Madina highway alone, prompting calls for the footbridges to be completed. Well, construction of the footbridges, which began in November, is nearing completion. At the time of our visits to the stretch on Sunday, work was ongoing as the engineers were seen busily installing iron rods, among other activities, to ensure the strength of the bridges. Some pedestrians who spoke with Joy News were hopeful the work would be completed by end of April 2019 deadline to reduce the number of accidents on the road.
I'm sure by the end of this month they will complete everything, because every Sunday they are working day and night. So I'm hoping they will complete things by schedule.
With the rate at which the work is actually going on, I think by the end of April, which is this month, probably. I'm not really sure though, but by how it's actually going, I think it can happen. We're just hoping to have a peaceful way of crossing the road and no more accidents, and just have a peaceful mind in the society. That's all we want.
In the next few weeks, it should be. I can see, even though I'm not a contractor, I can see that the project is almost 80% done. So in the next few weeks, it should be completed.
And what are you hoping to see after the completion of the project?
It's going to save our pedestrians from these dangerous crossings they've been taking part, and it causes accidents almost on a daily basis, and it's going to eliminate a lot of these road accidents along this stretch of road.
Our news team also observed some defiant pedestrians jumping over barricades right under the footbridge meters away from the pedestrian crossing in front of a Totu Teen school. A resident called on authorities to deploy officers to vantage points after completion to ensure that pedestrians and commuters alike make use of a facility.
Mostly no overhead, no. One way overhead, but
in certain areas, people still cross dangerously, even where there are footbridges. An official must be stationed here to check these activities.
The completion of the footbridges is expected to ensure safe movement across the highway to either sides of the stretch. Kenneth Awache Daku's report for Joy News.
Now, access to water and sanitation are basic human rights and are critical sustainable development challenges. That is why Goal 6 of the UN Sustainable Development Goals demand that by 2030, countries achieve access to adequate and equitable sanitation and hygiene for all. In face of this, Kumasi Metropolitan Assembly has teamed up with the Menchia South constituency in a cleanup exercise with focus on achieving this SDG target. It's part of the 20th anniversary celebration of the installment of the Asantehene Otumfuo Osei II. Prince Apia reports.
Choked gutters and bushy areas were desilted and cleared in a special cleanup exercise. More than 100 residents of the Menchia constituency and other parts of the Kumasi metropolis embarked on this exercise. Kumasi Mayor Osei MP reiterated the need to keep the environment clean in a bid to achieve the Goal 6 of the Sustainable Development Goals.
It was started by the assembly, but when the news started going out, then people started embracing it. And now look at the people around. You see, majority of them are youth. So when the majority of youth are getting the message right, then it means that the nation will have a future. Keep the city clean and green. The emphasis and the purpose was that if you catch them young, they grow with it. So now it is moving along from the school lines to the matured ones. So now if you go to the school children will be telling you, they will be rather whipping you to the slogan. And now my brothers have also joined in. Now the political parties have joined in.
The exercise was spearheaded by the Member of Parliament for Menchia South, who doubles as Education Minister, Dr. Matthew Opoku-Prempeh. It forms part of programs to mark the 20 years anniversary celebrations of the Asantehene Otumfuo Osei II. Officials say communities should not wait to be told to clean the environment in the face of growing insanitary conditions.
All various stakeholders, not only the MPs, should take it up. It's very important because look, the moment our surroundings are very dirty, it will go a long way to affect all of us. People are dying all because of small cholera, all right, dysentery. And I believe that if we day in and day out, we clean. Wherever you are, even in your own backyard, there might be something going on there. Don't wait for people to come and tell you that go and clean it up before you clean it up.
Meanwhile, the exercise will be repeated till the end of the anniversary celebrations.
We're going to replicate the exercise till Otumfuo ends his 20th anniversary. So, like you ask, everybody's here. I mean, we are here to help Otumfuo in the celebration of its 20th anniversary to make the...
Some residents and participants of the exercise say the cleanup is the least they can offer to make Otumfuo's anniversary grand. Prince Apia reporting.
Now, lack of a proper functioning health center in at least 3 communities in the Accra South municipality has forced the over 1,000 residents to rely on a poorly resourced CHIPS compound. The facility, which serves Ashalaja, Kwame Num and Krokrowe, is without beds and basic medical supplies. To add to their woes, the health workers there complain the toilet facility is also being taken over by community members who only leave an eyesore behind. Komla Adom visited the communities and came through with this report.
I took my 3-year-old son there, but nobody was there, so I had to bring my son home.
Just one of the stories highlighting a case of healthcare delivery on its knees at Kwame Num, Ashalaja, Hobo, and other adjoining communities in the Accra South municipality. 36-year-old Hannah's 3-year-old son is alive today only by a miracle, she tells me. After she visited the Kwame Num CHIPS compound at least 3 times the day her son's health deteriorated and met no one, she advised herself.
We need more personnel there, plus there are no furniture for patients, so sometimes we are forced to stand with our babies.
Apart from the human resource requirements, there are other needs. Ni Saban's daughter was delivered of a baby only a week ago. There are no beds and no seats. It's a worry. My daughter, while in labor, stood for long hours there. This CHIPS compound here at Kwame Num sits on a piece of land with torn window nets, defaced walls, and a toilet facility being abused by community folk. It looks like an abandoned building from afar. It has since outgrown its status as a CHIPS compound due to the over 1,000 patients it has to attend to should they need care. Joy News gathered since the health center 3rd October clinic was shut down 3 years ago. The health workers there were moved to join those at the Kwame Num CHIPS compound to provide basic services. I have come to see this clinic for myself. Huge cracks in the walls and the floor. It now serves as a place of abode for some squatters. The facility, which was donated to the community by a former member of parliament, Captain Nkrabia Ifadate, has been shut down for 3 years. The Accra South Municipal Health Director, Dr. Bright Davis-Tay, tells me an audit by the Assembly's engineers recommended the building be pulled down since it constituted a risk to occupants.
The assessment indicated that it was dilapidated to the extent that the cost of fixing it compared to building a new structure, it would be more cost effective to build a new structure. So the recommendation was that that particular structure should be pulled down.
With the 3rd October clinic no more operational for the past 3 years, and the CHIPS compound also not any better, the thousands of residents of Ashalaja, Kwame Num, Hobo, Manche, Krokoshe, and other communities are compelled to travel several kilometers to Amasaman to access healthcare.
By 7 o'clock,
I had a severe stomach ache last week. I was rushed there but met nobody. But what are the Accra South municipal authorities doing to deal with this challenge? Health Director Dr. Bright Davis-Tay tells Joy News the Assembly has lobbied the First Lady's office to intervene.
We contacted her office and she was very enthusiastic about assisting us. Initially, the plan was to get a CHIPS compound fixed, but from your side, you could see that there was another CHIPS compound that was sited at Kwame Num. And then Ashalaja CHIPS was just about 10 minutes walk. So we decided that why build another CHIPS compound if you can get a bigger facility that can serve both communities.
He says the contracts for the new health center project is at the bidding stage, and in 1 month, the First Lady Rebecca Ikufado will break ground for a 16-bed capacity health center for the people of the area.
I'm aware they are getting ready to even get somebody to come and prosecute the project for us. We have pinned down 8th May, barring any change in her schedule. She will be in Kwame Anum to cut the sword for the project.
He assures once the facility is built and operationalized, the woes of the people will be over. And to work on the new health center begins at Kwame Anum. This is what the over 1,000 residents here will have to make do with. Komla Adom, Joy News, Amasaman.
Still on healthcare, the medical superintendent of the Bimbilla Government Hospital as the Nanumba North Municipality in the northern region, Dr. Abdullahi Osman, has appealed to stakeholders to support the hospital with an ambulance to enable the hospital carry out referral cases. He also appealed for water for the hospital to ensure they are able to carry out their services. The medical superintendent said this when the Chamber of Mines donated an incubator and some hospital beds to the hospital.
Dr. Osman said the erratic water supply at the health facility was hindering quality healthcare delivery. He said this when the Chamber of Mines donated an incubator and hospital beds to the Bimbilla Government Hospital.
During the Ghana Health Service Northern Regional Annual Performance Review for 2018 held last month, Bimbilla Hospital came top with the ultimate position as the best performing hospital for the 2018. Based on a number of key indicators assessed. Some of these indicators included, but not limited to, significant improvement in neonatal mortality, improvement in infant mortality, and improvement in maternal care. In the case of the maternal health, the hospital had an increase in delivery from 1,788 in 2017 to 2,212. But with a reduction in maternal deaths from 5 to 1. One would have thought that with this increase, there will increase maternal deaths. And this translates to a significant reduction of maternal mortality rate of 279 per 100,000 live births to just 47. Mr. Chairman, Honorable MC, before I take my seat, I would like to state that despite the successes chalked by the hospital, the hospital is without challenges. Kindly permit me to enumerate a few. The hospital doesn't have an ambulance. We are facing erratic water supply, which is hindering on service delivery. Inadequate staff accommodation. Incomplete security fence wall, which allows stray animals in and out of the facility. We also have inadequate human resource. There's so much congestion in the wards, especially during the rainy season. There's also no functional X-ray machine.
He thanked the Chamber of Mines for the support. He said the incubator would save the hospital from referring preterm babies to the Tamale and Yendi hospitals.
Mr. Chairman, Honorable MC, as a hospital, our core mandate is to improve the health status of the citizenry and to ensure that all clients that visit the hospital return home fit and well. Provision of this medical equipment, especially the incubator, would help improve the management of preterm babies delivered in the hospital. Currently, the hospital has to refer most of these babies to either the Yendi Municipal Hospital or the
Now, a baby born less than a week ago as Nadoli in the Upper West region may not survive much longer unless his parents can mobilize 12,000 cedis he needs for an emergency operation. He has been diagnosed with hydrocephalus and spinal bifida even before he's old enough to be named. His parents, who are subsistence farmers, say though they have looked forward to the birth of their son, they don't have the means to pay for the surgery. Joy News' Upper West Region correspondent Rafiq Salam visited the neonatal ward of the Nadoli Hospital and reports his situation continues to deteriorate with each passing day.
His delivery was especially challenging because of the size of his head. Doctors therefore had to perform a cesarean on the mother. That was when he was found to have the defects. Nurses at the Nodoli hospital, where he was born, named the boy Baby Agnes after the mother, Agnes Lebalanye. Dr. Matilda Asayoro, one of the doctors who delivered baby Agnes, explains his condition.
Hydrocephalus is simply an accumulation of fluid, cerebrospinal fluid, in cavities that are deep down in the brain, called ventricles, resulting in enlargement of these ventricles, and hence enlargement of the head. That is why this baby has a big head. There are other problems that can be associated with myelomeningocele or spina bifida, among which are paralysis of the legs. This baby, in fact, has paralysis of his legs. There's no power in the lower limbs. And also there's lots of sensation in the legs.
Acting medical superintendent of the Nadolo Hospital, Dr. Ibrahim Donko Muslim, stated that the condition, though strange, can be treated if given the appropriate and much needed care.
And the good information is that it can be treated, but it can only be treated at a certain cost that is not available to this poor woman. So our cry is that can we come together and then mobilize resources to treat this child's condition? Because once this condition is treated, then the child has a good, survival, potential, and then can grow to achieve his full life potential. So we are calling for treatment, and then the support to help this treatment become a success.
Direct any possible support to us here at Joy News, and we will get you in touch with the family. We're still live on Joy News today with me, Daniel Daza. Darryl Cow is standing by to bring us the latest in business. And the government has received a 180 million credit facility from the Indian Exim Bank for agri mechanization. There's more after this.